So hi everyone, for those of you who I haven't met before, I'm Clara and I'm Head of Engagement and Partnerships. And as Gary said, I just wanted to give you a bit of an update in terms of the approach we've taken to our engagement work and where we see it going. So at Involve, we don't just see engagement and participation as activities, as tick box exercises or nice to have. They really form part of our culture and are really, really central to our commitment of working in partnership with individuals and communities to tackle issues and tackle inequalities. And underpinning all of our engagement work is our genuine belief that lived experience should be heard and valued wherever decisions are being made. So we see that the case internally, so when we look at the decisions we're making within Involve, where lived experience should be central to how we design, deliver, improve and implement our services, but we also see that as the case across the wider system where lived experience should be being taken into account, and we see our role as facilitating that, bringing down barriers and amplifying the voices. So across both of those areas of engagement, we have the same baseline, the same framework that we work towards, and we call it the LEAF framework because it's a lot easier to say, but it's the Lived Experience, Engagement and Employment Framework. So this was a framework designed by the Integrated Care System, and it was actually designed to give a baseline to how Kent County Council, Medway Council and NHS Kent and Medway do their engagement work. But for us at Involve, what it's done is given us a really consistent baseline to all of our engagement work. It's also provided us with some really key definitions, which is really, really vital in this area of work. There's a lot of overuse of language and a lot of misuse of language, which is actually watering down the power that lived experience should be having. So it gives us those kind of key definitions to work towards. It's also really strengthened the way that we're reviewing, evaluating and capturing our engagement work, which is really, really vital to making sure that everything that we do is meaningful, that we're avoiding that tokenistic practice and that we aren't over-engaging. It's also helped us to unify the way we work within Involve. As you've heard by now, we do have quite a number of different services and they all work in quite different ways to support the communities that they serve, but it's really, really important that we're working to the same best practice standards across engagement. And it's also helping us contribute towards a unified system. So if we want lived experience to be taken seriously, it's really, really important that everyone across the system is working to the same standards to make sure that those with lived experience are given the respect that it deserves. So firstly, starting off with what we've been doing internally. So one of the main focuses we've had recently has been on our employed lived experience. This can often be a really overlooked area of engagement. I think a lot of organisations are quite quick to think about service user steering groups and forums and advisory panels to try and incorporate lived experience, but actually a lot of organisations can ignore the fact that one of the best ways to do it is to just employ those voices within the services. It's something that we've been quite proud of at Involve. We've always had an idea that we do have a lot of employed lived experience, but this has been information that we've kind of held informally, so just through knowing our team members, knowing our colleagues. But we wanted to formalise that and really understand the extent and location of lived experience within Involve. So we've carried out our first ever organisation-wide lived experience survey, and we had an absolutely phenomenal response. I think we were all expecting fairly good responses, but so in total we had 47% of staff, so just under half of staff taking part, which for the first time we've ever done this, and considering no one is ever required to share information about their lived experience, that was a pretty phenomenal response. And even more impressively, 96% of those staff who took part identified as having relevant lived experience, which was much, much higher than we'd anticipated. So I promise you I could talk about this for hours, but I've just picked out some of the kind of highlights from the data. So we heard from staff across 11 different teams within Involve, which was a really good indicator to us that we were hearing from kind of the whole width of the organisation. And we also heard from, so 82% weren't in management positions, 16% of staff were in management positions, which included senior and executive management levels. So it showed us that not only was that lived experience embedded across the organisation, but it was also embedded and carried through the whole organisation. We also asked individuals about the relevance of their lived experience, and everybody, so 100% of the staff who identified as having lived experience confirmed that it was relevant either to the communities that their teams supported. So that could be, for example, someone working on the carers team identifying as an unpaid carer. Sorry, I've lost my train of thought. Yeah, so 100% said that it was relevant to the communities their team supported, or to the communities we support a bit more widely across Involve, or to a combination of both. So it showed us that we had a real kind of representation across the organisation. We also looked into timeframes to try and see were we employing people who had lived experience that was all from their past, or to see whether it was ongoing. We had a really good spread again, so just under half reported that their experiences were still ongoing. 31% said it was from their past, and then 22% indicated that it was a combination of both. We also were really keen to hear from people about the impact that experience was having on their role. And we were really pleased to hear that for a lot of staff, it had been the kind of motivating factor behind either them wanting to take on a supporting role or to work for Involve. And a lot of staff also mentioned that it gave them either more empathy, understanding, or a combination of both. But rather than me talking on that too much longer, we've had two staff members who have been really open and willing to share their stories. So firstly, we're going to hear from Jackie, and then we'll be hearing from Ben in their own words on the impact it's had.
I have been working with carers for 17 years. I brought with me experience of working as a support worker with the crisis mental health team, which gave me insight and understanding into mental health issues and different ways of helping those who are struggling in this area. I have lived with hearing loss for 30 years and am able to use my lived experience to better understand and advise carers or those they are caring for who are managing hearing loss. Just last week, one carer said that it had been invaluable speaking to someone who could not only give advice but who genuinely understood what she was struggling with. I also have lived experience of caring for a family member with autism, dyslexia, anxiety and depression. I am constantly using the knowledge and skills I have learned over the years to help carers dealing with these difficulties. Each case is different, and I often learn something new, but having lived personal experience definitely helps to guide my thinking and conversations. I feel the lived experience I have brings value and an extra depth to the support that I offer to carers.
My name is Ben Harmon. My role is a dynamic support advocate as part of the Dynamic Support Service commissioned from KCC, and our role is to provide practical and emotional support for under 26s with complex autism and learning disabilities who are in crisis, usually in direct pathway to Tier 4 hospital admission, and our role is to try and provide community support to avoid that where possible, so that they don't spend ages in hospitals. My lived experience is in mental health, neurodivergence, both ADHD and autism, suicide, addictions, alcohol and drug, gambling, impulsive behaviours, caring. My lived experience has impacted my role with Involve by being able to provide me with practical experience of what the young people I help support are going through, an understanding of how their mind works in a lot of cases, and an empathy to their struggles, both internal and to the wider system that has often let them down, which helps me build rapport with them, build trust with them, and be able to help make influential changes with professionals and existing networks. How it connected me to service users? Well, by giving me an understanding of how they are, and that they also know that I struggle in a similar way to them. It's helped build trust and connection very quickly. In most cases, it's helped us be able to communicate using language and comparatives that most people wouldn't understand because they don't think the same way. They don't see the world in the same way. And it influenced me to apply for the role, partly because the role required lived experience, but also I want the world to be better after I leave than how I came in. And if I can make some people's lives a little bit better with my experience, then I want to. I don't want other people to go through the same problems I did. And if I can make any impact on that, then I will.
So I think that perfectly summarises the power of lived experience and the immense value that it brings. So a huge thank you to Ben and Jackie for those messages. As I said, we don't just focus on kind of within the world of Involve when we're looking at engagement, so we're also constantly looking externally to try and amplify the space that's given to lived experience. So we spend a lot of time mapping and identifying engagement opportunities, so that could be consultations, engagement projects, it could be health research that's going on locally. We also spend a lot of time promoting those opportunities to individuals who may be interested in taking part, and we do that through a number of different channels, so through our different newsletters, forums, social media channels, through direct conversation with people that use our services as well. We do also deliver engagement projects, which gives us an ability to really maximise the involvement and break down as many barriers as possible so that everyone who wants to have their voice heard is able to have their voice heard. And we also spend a lot of our time focusing on appropriate compensation, which is a really, really huge part to engagement work. A lot of times all organisations will offer is compensation for travel costs, which just doesn't go far enough. It doesn't acknowledge the value and the skill that lived experience is bringing. So this is another sort of large area of our engagement work. So this is very much not the end, it's the beginning of this work, so we've got huge, huge plans to keep driving all of this forward, to keep maximising that engagement and making it as meaningful as possible. And I just wanted to highlight some of the opportunities that we're looking at the moment. So we want to ensure that our planning is really consistent, so we want to introduce new processes that will take us through all of the relevant considerations when we're actually at that planning stage of our engagement. We're also looking a lot at our feedback at Involve, trying to introduce new ways, better ways of capturing formal and informal feedback, and also introducing more of those feedback loops so that people aren't just endlessly giving you feedback, but actually can see where it goes and what happens and hold you accountable for it. We're also looking at our employed lived experience still, so we're continuing to analyse the responses that came back, especially around how we could better recognise or support those with lived experience. And we have also made our lived experience survey annual so that we can keep that data as relevant and up to date as possible. We're also continuing to look for new opportunities, new ways for people to get involved in engagement, so we'll continue that mapping exercise that we do, and we're also looking at establishing a network of service user groups within Involve to help feed into all of our services. We're also working on reviewing all of our current engagement activities to make sure that we really have kind of a sense of what we do, what we're doing well, and that helps then with kind of learnings going forward. We're also focusing a lot on recruitment to make sure that we review our recruitment practices so that we can better prioritise lived experience and to make sure that we can maximise the number of designated lived experience roles where possible. And we're also continuing to hold ourselves to alignment with that framework and identify new ways that we can make sure our work complies with those best standards. So that's the end of our current plans, although I think they will probably continue growing, and I do really urge anyone here who has any sort of thoughts, feedback on any of this, please do come to us. It's very much an open conversation, and we've got a real kind of driving force behind this, so we do please want to hear from you. And I just wanted to also end by saying a huge thank you to everyone who has so far been so open and willing to share their lived experience with us, because genuinely this would not be possible without you, so just a huge, huge thank you.